Welcome back. Now that we've sort of demystified the surgery itself, let's shift gears and talk about what happens afterwards.
Okay.
Recovery is just as crucial as the procedure itself,
Right.
wouldn't you say?
Absolutely. Recovering well is key to enjoying those healthy gums we're aiming for.
Right.
So spill the beans. What kind of post-surgery instructions should we expect?
Well, your dentist will provide you with detailed instructions specific to your procedure.
Okay.
But some common themes revolve around managing pain, caring for that periodontal dressing,
Okay.
dietary restrictions, and of course the no smoking rule still applies.
Yeah. Let's break those down one by one. Starting with pain management. What's the recommended approach for those first few days after surgery?
Acetaminophen,
Okay.
often known as paracetamol, is generally the go-to pain reliever.
Okay.
It's effective and gentle on the stomach. You can typically take it every 4 to 6 hours as needed. Okay. It's worth noting that you should avoid aspirin, as it can increase your risk of bleeding.
Okay, so acetaminophen is our friend.
Yes.
Aspirin, not so much.
Right.
Now, about that periodontal dressing we talked about earlier,
Yeah.
any special care instructions for that little gum guardian?
The best thing you can do is to leave it alone.
Okay.
It's there to protect the surgical site and let your gums heal undisturbed. You'll go back to your dentist to have it removed at your follow-up appointment.
Got it. Hands off the dressing.
Yeah.
Makes sense. Now let's talk about food.
All right.
What can you eat after surgery? Are there any restrictions?
You'll need to avoid anything too hot or spicy for a while. Think lukewarm or cold foods
Okay.
for the first 24 hours. Also, it's best to stick with softer foods that are easy to chew and won't irritate the surgical site.
So it's like a temporary break
Yes.
for your gums
Exactly.
from anything too extreme. Got it. Now let's paint a picture of the first week of recovery. What can someone typically expect?
It's perfectly normal to experience some slight bleeding, sensitivity, and swelling during that first week. It's all part of the healing process.
Okay.
So don't be alarmed. Just stay on top of your pain medication as directed.
Right.
And follow those post-op instructions carefully.
So a little discomfort is par for the course.
Yes.
But nothing too dramatic.
Exactly. And remember, you'll have that follow-up appointment with your dentist during that first week. They'll examine your gums, remove the dressing, and answer any questions you might have. It's a chance to ensure everything is healing as it should.
Speaking of the follow-up appointment, what exactly happens during that visit?
Well, after removing the dressing, your dentist will take a close look at your gums to assess the healing progress. They may irrigate the area with an antimicrobial solution to further reduce the risk of infection.
Okay.
In some cases, if healing is a bit slower, they might choose to repack the area with a fresh dressing.
So it's like a progress check.
Exactly.
To make sure everything is on track.
Right.
Now, what about oral hygiene during recovery? Can you brush your teeth?
Once the dressing is out, you can start brushing again, but be extra gentle. Around the surgical site. A soft bristled toothbrush is your best friend during this phase.
Okay.
Your dentist might also recommend using a chlorhexidine rinse to keep bacteria at bay and promote healing.
So we're talking gentle brushing and a bacteria-busting rinse.
Yes.
Got it. Now let's talk about that dreaded postoperative sensitivity.
Yeah.
Is that zapping sensation when you eat or drink something cold?
Yeah.
A common experience?
You're not alone.
Okay.
Root sensitivity is a common side effect after periodontal surgery, especially when the root surfaces of your teeth are exposed. It's temporary, but it can be a bit annoying.
So what can we do about it? Is there any way to tame those zings?
Well, the good news is that it tends to subside as your gums heal. In the meantime, there are desensitizing toothpastes and mouthwashes you can use at home.
Okay.
These work by gradually blocking the tiny tubules in your teeth that transmit sensations to the nerves.
So a little patience and some desensitizing products can go a long way. What if those home remedies aren't doing the trick? Are there any in-office treatments that can help?
Absolutely. If the sensitivity and particularly bothersome, your dentist can offer a few different options. They might apply a fluoride varnish or a desensitizing agent directly to the sensitive areas. In some cases, they might recommend covering the exposed root surfaces with a protective resin.
So if the at-home approach isn't cutting it, your dentist has a few more tools in their arsenal to help manage that sensitivity.
Exactly. It's all about finding what works best for you and ensuring your recovery is as comfortable as possible.
Okay, we've covered a lot of ground on the post-surgery recovery front, from pain management to oral hygiene and dealing with sensitivity. Let's pause here for a moment, and when we return, we'll wrap things up with some key takeaways and final thoughts to empower you on your periodontal journey. Okay. We're back. We journeyed through the pre-surgery prep.
Yeah.
Navigated the procedure itself. Explored the road to recovery.
Right.
Before we wrap up our deep dive,
okay,
let's revisit some key terms and highlight those golden nuggets of knowledge that will empower you on your periodontal surgery journey. What stands out to you as we reflect on this information?
I think it's remarkable how much attention is given to creating the optimal environment for healing even before the surgery begins.
Right.
We talked about scaling and root planing. Remember those terms?
Yeah. Scaling is all about removing that pesky plaque and tartar buildup above and below the gum line.
Right.
While root planing smooths out those rough spots on the tooth roots where bacteria like to hang out.
Exactly. It's like giving your gums a fresh start. And then there's the medication trifecta, antibiotics to combat infection, NSAIDs for pain management, and chlorhexidine to keep those bacterial populations in check.
Right.
These all work together to minimize the risk of complications and promote smooth healing.
And don't forget the importance of quitting smoking, even temporarily.
Yes.
It's a game changer when it comes to healing and long-term gum health.
Absolutely. It's one of the most impactful things you can do to enhance your recovery. Now, during the surgery itself, the use of local anesthesia ensures a pain-free experience.
Right.
And for those who grapple with dental anxiety, various sedation options are available to make the process more relaxing.
Right. Sedation can really make a difference in putting patients at ease. Now, we also delved into the concept of hemostasis.
Yeah.
What's fascinating about that is the focus on meticulous bleeding control. It's not just about keeping things tidy. It's about optimizing visibility for the dentist and minimizing blood loss for the patient.
Exactly. It's a testament to the precision and attention to detail involved in periodontal surgery. And then there's that trusty periodontal dressing, the protective shield for your gums during the healing phase.
Right. And we can't forget about postoperative sensitivity.
Yeah.
It's reassuring to know that even though it's a common side effect, there are both home remedies and in-office treatments available to manage those zings and ensure a comfortable recovery.
It's all about empowering patients with knowledge and options by understanding the why behind the recommendations. You're better equipped to make informed decisions and actively participate in your oral health journey.
You've got this.
Yeah.
Armed with this knowledge, you're ready to face periodontal surgery with confidence.
That's right.
And embrace those healthy gums waiting on the other side.
Yes.
Remember, communication is key. Don't hesitate to ask your dentist any questions, express any concerns, and advocate for your comfort throughout the entire process.
Well said. It's a collaborative journey, and your voice plays a vital role in achieving the best possible outcome.
So there you have it, a deep dive into periodontal surgery. Demystifying the terminology and equipping you with the knowledge to navigate this experience with confidence and ease.
Remember, knowledge is power. Yeah. The more you understand, the more empowered you are to make informed decisions about your oral health.
And that's what the deep dive is all about. Thanks for joining us.
Thanks for having me.